Okay, my name is Mallory Little, and I'm a graduate student at the Mississippi University for Women. I'll be reviewing an article entitled Early Maternal Language Use During Book Sharing in Families from Low-Income Environments. The research study was performed by Linzy M. Abraham, Elizabeth Kreis, Lynn Vernon Fagans, and the Family Life Project Phase 1 key investigators. So I'd like to start out by giving a brief overview about the importance of parental language use in a child's language development. As studies have confirmed, early language abilities are a strong predictor of later language and literacy abilities. Additionally, children acquire language in the context of their homes through interactions and transactions with the individuals around them. This primarily transactionist or interactionist approach to language acquisition hones in on the importance of parental input and language use in the early years of language development. So, what factors influence how a mother speaks to her child? Two commonly accepted factors include education level and income, specifically regarding the mother. Studies have shown that mothers from low-income households with a low education level use less diverse and less complex language when interacting with their children. Vernon Fagans et al. Found that maternal education, knowledge of child development, and child temperament predicted the complexity and diversity of maternal input. The age and ability of the child, such as how often he or she attempts to communicate with the mother, also influence the frequency and diversity of maternal language input. Rowe and his colleagues, for instance, found that during shared book reading, parents spoke differently to infants than they did to preschoolers. So when talking with infants, parents used very literal language pertaining to the book and what is on the page, whereas with preschoolers, parents were more likely to expand what they were talking about and talk about topics that weren't found on the page. And there are roughly 11 million children in the United States who live in low-income or poverty-level households, so it's really important that we figure out how these parents are using their language and how it affects the language development of their children. The researchers discussed different types of parental language use, focusing on increased language productivity as the most important factor in facilitating language development. Pretty much the more words a child hears, the more likely it is that these words will be varied, and the more likely it is that the child will hear words that are not frequently occurring in our language, or words that are more rare. Although productivity is important, the content of what the parents are saying is also important. Research has found that language modeling, communicative style and responsiveness, and the use of language strategies all contribute to language acquisition. The researchers of this study decided to use shared book reading interactions as an opportunity to examine parental language use. The research design of this study is a longitudinal research design which uses sampling methodology and analysis. A hierarchical regression analysis was used in order to determine which variables were predictive variables. Shared wordless book reading was seen as a great option for evaluating the parental language because it's a language facilitating context in which the mother and child are able to interact with minimal scaffolding without having to pay attention to words. The study is different from many studies in that it expands the sample to include infants in lower income and rural families, because previous research studies have focused on preschool children in middle to upper class homes. So in this study, data was collected at two different time points, one at the 6-month time point and once again at the 15-month time point. The researchers explained that the purpose of the study is to identify relevant predictors of maternal language use at the 15-month time point. It's important because knowledge of the input gives us a greater understanding of the child's communication development. This understanding can potentially lead to a reduction in risk of language delays. Participants in this study were drawn from a pool of participants of the Family Life Project, which is an ongoing study of infants and their families from low-income areas. 82 families were selected from the 113 available. All of the families were Pennsylvania residents, and they were all Caucasian. In order to be considered for the study, the family's income must be at or below 200% of the nation's poverty level at both time points. So this means that the child lived in a household of persistent low income or poverty during the course of early language development, and all children were between 5.5 and 7.5 months at the time of the 6-month time point. So that means that at the 15-month time point, they were all between 14.5 and 16.5 months old. 2 in-home sessions were performed for each family, one at the 6-month time period and again at the 15-month time period. Data collection about demographic information was collected at each point. In addition, both times the mothers were given a wordless picture book to be read or talked about to their child so that the focus was on communication rather than on the words on the page. The books were age and interest appropriate for the children at the age that they were, and the interactions were video recorded. Information was retrieved by the Family Life Project investigators regarding the mother's education level and the family's income. The interactions that were video recorded were transcribed and entered into the SALT program by trained graduate students. And these graduate students had received at least 3 months of training prior to using the software in the study. So the students transcribed the mother's language in order to measure the number of different words used. So this number is what the researchers used as the measure of maternal language productivity. At the 15-month time point, the child's communication attempts were transcribed as well. Each attempt at communicating was counted as one utterance. And finally, the students classified the mother's utterances by strategy. Immediate strategies are responses that are literal in nature, pertaining mainly to what is represented on the page. So these include labeling, seeking participation, answering one's own question, using prohibitions, and encouraging attention and continuing interaction. Elaborated language strategies, on the other hand, involve topics that were not directly represented by something in the book. These include adding information beyond the book, relating the book to the child's life, and attributing meaning to child's actions or behaviors. As I said before, all transcribers were trained for 3 months for 12 to 13 hours weekly prior to the research study. In addition, inter-rater agreements regarding word boundaries, utterance boundaries, and the occurrence of child communication attempts were at least 0.99, which shows that the coding and transcription were reliable. The researchers found that at both time points, more than 70% of the mothers had at least a high school diploma or GED. However, less than 10% of the mothers had received a college degree. When looking at language productivity and language strategies used, there was much variability. For instance, at the 15-month time point, the fewest amount of different words used was 9, while the greatest amount of different words used was 187. Similarly, there was a broad range in duration of interaction at the 15-month time point, although that range was much more narrow at the 6-month time point. At the 15-month time point, the shortest interaction lasted 32 seconds, while the longest interaction lasted 602 seconds. Overall, the rate of use of immediate strategies was greater at both time points for all parents than the rate of use of elaborated strategies. This means that at both time points, mothers were much more likely to use literal language that pertained to the things right in front of the child. Children's communicative attempts at 15 months ranged from 0 to 57 total attempts, with 50% of the sample using fewer than 6 communication attempts. In order to analyze the results, the researchers performed a hierarchical regression analysis. The outcome variables representing maternal language use include rate of use of immediate strategies, rate of use of elaborated strategies, and language productivity. Predictor variables included maternal education level and family income to needs ratio at the 6-month time point, number of child communicative attempts at the 15-month time point, and maternal language productivity at 6-month time point. So basically, the researchers wanted to see if the mother's education level and income, how responsive the child was during the interaction, and the number of utterances from the mother at the previous time point could predict how the mother was using language at the 15-month time point. The most significant finding was that there were several significant predictors of the mother's 15-month language productivity. These include the child's attempts to communicate during that interaction, how much the mother used language at the 6-month time point, and the mother's rate of immediate strategies at the 6-month time point. This means that basically the more the mother talked at 6 months predicted how much she would talk at 15 months. The more the child responded during the interaction was also affected how productive the mother's language was. And finally, the more the mother used immediate strategies at the 6-month time point, the more productive her language was at the 15-month time point. The researchers think that the use of immediate strategy could be seen as a scaffolding technique in order to facilitate infant communication. So basically, the mothers are talking about things that are right in front of the child in order to try to get the child to respond. As I said, there is a great variability between the amount of language used by the mothers as well as duration of interaction. For the children at each end of this broad range, their experiences were extremely varied and different. While one child is taking in complex and diverse vocabulary and language forms, the other child isn't. Because the child who is receiving more input is more likely to respond, this leads to even more input from the parents, and thus the child's language gets richer and richer. But for the child whose experience is not as fulfilling, this cycle of input isn't happening. As seen in the results, all mothers use concrete language more frequently with their infants. Like I said, can be seen as a kind of scaffolding. The more literal language may be encouraging their child to respond. Overall, high productivity equals more words, equals more diverse words in different contexts. But what about the elaborated strategies? Aren't abstract language forms just as important as the literal, more concrete language forms? And I think they are. Mothers who use these elaborated strategies at 6 months were likely to use the strategies when their child was older. And as the article points out, Cleek et al. Found that when parents use different levels of abstraction in their language, it supports their child's language development. So, in summary, mothers' early language productivity and child responsiveness are good predictors of future maternal language use. This study looked at maternal language use and took into account the mother's education level and family income. So the focus was primarily on how maternal language use is predictive of later maternal language use. The fact that family income did not appear to be a great predictor of future maternal language use is not surprising when we realize that all of the subjects fell within a very narrow range of family incomes due to the inclusion criteria. So finally, I'd like to point out that the different kinds of communicative attempts did not have any effect on maternal language use, though the frequency of the child's communication attempts did. So it didn't matter if the child gestured, used a true word, or just made a vocalization. That didn't affect the maternal language use. It was the number of communicative attempts from the child that did have an impact on maternal language use. The researchers address a few of the study's limitations. First, the study was performed based on single episodes of shared book reading, so it's possible that these single episodes are not representative of how mothers would communicate given multiple opportunities and different books. Additionally, future research should expand to include analysis of more spontaneous daily language rather than just structured book sharing. And finally, the researchers admit the need to question the mothers as to their literary habits at home. Like, how often do they read to their child? What kind of books are they reading to their child? Do they talk about the books? Those kinds of questions would be helpful in future research. This research implies, in my opinion, some very important points. As stated by the authors, this study provides evidence that the nature of mothers' language use with children as early as 6 months is relevant to later outcomes. So, as SLPs, this is important for us because many parents don't know how much they can be helping their child simply by talking to them. For this reason, parent education and family communication enhancement programs, especially in low-income areas, could be helpful in addressing the risk of language delays. In addition, it points out to us the importance of early intervention, specifically intervention that incorporates parents and caregivers and elicits natural opportunities for these language transactions to occur. So what did I think? I think this article points out the crucial role that parents play in their child's language development, but more than anything, it gave me a perspective from which I can evaluate and relate to low-income or poverty-stricken children with language disabilities and delays. As a child, I was reared in a language-rich environment created by my mother who loved words, loved books, loved crafts and games, and most importantly, had the time and energy to interact and talk to me on a daily basis. This encouraged my language development, my literary achievement, and my academic success, and it all started the first time she spoke to me. Other children weren't as privileged. As far as the strengths of the research, it seems that they covered all of their bases to me. The study design was strong. They very clearly pointed out the validity and reliability of data collection and transcription, and thoroughly explain all of the methods and procedures. One limitation I noticed is that because there's a very specific sample population, there was no clear way to imply that education or income have a direct impact on maternal language input. I would also have been pretty interested to see the types of communication attempts that the children were making. Although the article labels the different kinds of attempts, it also states that each communication, no matter if more than one kind of attempt was used, was labeled as one utterance. So this basically means that if a child used a true word coupled with a gesture, it was counted as one utterance. And if a child made a vocalization that had no meaning, it was also counted as one utterance. I would have been really interested to see specific results about the amount and type of the child's communication. Clinically, this study informed me really of the importance of early intervention and parental education. Many parents aren't aware that their infant is benefiting from the words he or she can't understand or say. So if we get them to understand not only the benefit of parental language input on language development and potential academic success of their child, but also the difficulties that arise from a lack of language interaction, we can possibly reduce the risk or impact of language delays on our clients. We can teach them just how important it is to talk to their new baby.